Okay, can start today. There are two cases. The first case is siapa patient?
Saya.
Okay. Second case Arfa kan?
Saya Arfa.
Arfa, okay. Second case Arfa. First case apa tadi? Akil ya?
No, bukan saya.
Siapa tadi? First case.
Saya.
Boleh buka
Syahidah.
anu tak? Syahidah ya. Okay. Boleh buka anu Siapa yang nak kelak? What is the next in the list? Siapa nama student?
Boleh saya kelab, Dato'? Dato', boleh saya kelab. Saya
You
volunteer.
nak volunteer nak kelab?
Yes.
Okay. So you can volunteer collecting. Okay. You start with the first case first.
Wait, I'm going to take my pencil first.
Buka lah you punya anu. Okay.
Sorry, saya buka pakai telefon, tak apa kan? Okay, saya start Dato'.
Boleh start boleh.
Okay. Hello, my name is Muhammad Hakim Reza bin Wasli. I'm a medical student. May I ask you some question?
Yes.
Okay, so I would like to reconfirm. May you please state your name and age if possible?
I'm Lo Sui Moy. I'm 29 years old.
Can you repeat your name?
Lo Sui Moy.
Lao Simoy, okay. Okay, Lao Simoy. 29 years old. Okay, may I ask you, what is the cost? What is your purpose of coming here? Why do you come here?
I have fever.
You have fever. Okay. Fever. Since when?
Last 4 days.
Since the last 4 days. Okay, so before that, you are healthy.
Yeah.
Okay, I see. So, can I ask you, how is your fever? What do you feel when you're having the fever? Is it very high fever? Is it just like slight fever, something?
I think it's high grade, maybe.
High grade. Did you check your temperature before coming here?
No,
No, you didn't check your
but
temperature.
I feel very hot.
You feel very hot.
Yeah.
Okay, I see. Okay. How about now? What do you feel now?
Still hot.
Still hot. Okay. Did you feel any other symptoms apart from that fever?
What are the symptoms?
For example, like do you feel like coughing, or you have like flu-like symptoms, or do you have dizziness?
Dizziness? No.
No dizziness.
Coughing? No.
No cough.
But severe headache? Yes.
Severe headache. Very severe. Okay, severe headache. Other than that, do you have like any joint pain? Or any
Joint pain?
hospital?
Yes.
Joint pain. Okay, sore in the body, muscle
Muscle pain? Yes.
pain. Also, did you have did you experience any weakness?
Sorry, what?
Weakness.
Weakness?
You feel very lethargic.
Not
You feel like
really. What
don't
is
want to move.
lethargy?
Okay, you feel like you're very tired for unknown reasons, even though you didn't do anything? You feel very tired?
No, really.
No.
But I have
Okay.
backache.
Bake cake. Okay, bake cake. I see. Okay. So no flu-like symptom. No runny nose. No.
No,
Okay. Um. Did you have any rashes?
no.
No. No rashes. Okay. So I would like to ask about your fever a little bit more. How about the timing of the fever? For example, like if the fever only appears at night, or if the fever continuous, sometimes the fever you feel better, and then or sometimes or is it continuous fever, something like that?
I just know that it's sudden onset.
It's sudden,
I'm not sure.
okay,
Yes.
and then it is continuous, like you feel hot for the past 4 days,
Yeah, yeah. Maybe. I'm not sure.
maybe, or maybe okay, hot for the last 4 days. Yes. Okay. Did you find out that any actions that may make the fever better, or any actions that may make the fever worse?
Yeah, you mean that any medicine I took?
It can be, yes.
Yeah, I took 2 tablet Panadol.
Panadol. So how do you feel after that?
But not
Better?
much improvement actually.
Not much improvement. Okay.
Just slightly better. Slightly
Slightly,
better.
slightly. Okay. Uh, for example, like if any other
And actually, I take bath 3 times each day. Yeah,
for the Panadol,
because I feel hot, very hot.
you take what?
Yeah,
What did you take?
Panadol, and I
Panadol.
take bath 3 times per day. Take bath, and
Oh,
sponging.
okay, okay, okay. Okay, you take shower. Okay, you feel better after shower. Okay, because of hotness. I see. Uh, okay. At the home, did you have like any aircon, air conditioning, or is it when at night you become very cold?
Mm,
Anything? No,
no,
is wet the cold make your fever worse or what?
sorry, what?
Okay. So I want to ask like whether the fever become worsens because of the temperature.
No.
No. Okay. No. Okay. And then I would like to ask about your headache. So can you describe
Mm,
the headache? What did you feel about the headache? How did you feel? Whether if I would like to give an example, whether you feel like pressure, throbbing, or something like that about your headache.
just severe. Maybe
Severe
just
headache.
something pulling my head. Just that.
Something like someone pulling your hair. Okay, I see about the headache. So did the headache also like become better after you eat Panadol?
Just slightly better, not
Slightly
much.
better. Same. Okay, not much. Okay, so from if I would like to give score pain from 1 to 10, where 1 is very mild, it's not a very it didn't affect your life, and 10 is very painful. So how will you score your headache? You,
Maybe 8 of 10.
can you repeat?
8. Yeah.
8.
8.
So it is very severe.
Yeah,
Okay.
because it's
So
very severe.
when you have the
Yeah.
headache, you cannot do anything.
Yeah.
Okay, I see. Okay, so I would like to ask questions some questions. Okay, first one I would like to ask about when you have the fever. Did you experience anything like blurriness of vision, hallucination?
Not at all.
No, none. Okay. How about your heart rate? Do you feel your heart rate increase? Like you can hear your heartbeat, palpitation, sweating?
No.
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 Palpitation, no sweating. Okay. How about your uh, respiratory rate? Did you feel any difficulties in breathing?
No.
No. No. No difficulty in breathing? No. Also, how about your appetite?
Appetite?
Yes.
Yes. Lost appetite.
Loss
Just
of appetite.
yeah.
Okay. Did you did you feel like you have lost some weight for the past 4 days?
I don't think it affect my weight. No.
No.
Just last. Yeah.
Loss of appetite.
Yeah.
Okay. Did you feel stomach pain or something like that? You have like diarrhea,
Diarrhea? No, but just nausea for
nausea,
sometimes.
nausea, and vomiting. Do you vomit or not?
Mm.
Do you feel like
Yes.
you vomit?
Yes.
Vomit.
Vomit. Yeah.
Uh,
I had diarrhea before.
Also diarrhea before.
Yeah.
Okay, I see. Any changes in your urine? For example, increase in frequency, changes in color and amount,
The urine output actually less than
less than
common,
before,
less than usual.
less than
Yeah.
usual. How about the color?
Oh, I didn't notice any changes.
Any changes in color? So I would like to ask about the urine. Because you have lost fever, loss of appetite because of this fever. Uh, did you notice your amount of water, your water intake amount less than before or still the same?
Um, I think less.
Less. Okay. And then, mm, okay. So I would like to go through your medical history, the past history. Okay. So any previous medical problems?
Um, no.
No. So you're healthy. Okay, good.
Yeah.
Any drugs you have taken? For example, other than Panadol?
No.
No, no drugs. Okay. So I would like to ask, are you smoking? Did you take any alcohol?
No.
No, no smoking, no alcohol. Okay.
No.
Okay. Smoking, no alcohol. Did you travel for the past few days anywhere?
No.
Did you travel anywhere? No. Have you eaten outside for the past 4 days?
No. No.
So you cook at home.
Yeah.
Uh, how about what is your occupation, your job?
Uh, I'm just a housewife.
You're a housewife, I see. How many? Okay, housewife. I see. Okay, how about your family members? Do you have like any past any family members with history of medical problem?
No.
No, no. Is your mom and dad still alive?
Yeah.
Okay, life and healthy
Yeah.
and healthy. Okay. Did you said you're a housewife, right? Did your husband travel anywhere for the past few days?
No, he was with me.
He was with me also. He was with you. I see. I see. Okay. Okay. Thank you. That's all I think. Thank you. Thank you for your cooperation.
Okay.
Okay. So I would like to summarize this patient. Okay. The patient Lau Shimoy, 29 years old, comes with complaint of shift complaint of fever. So the fever, she said that she experienced the fever since the last 4 days. And with the fever is high, she said that she has a high grade fever, and also with severe headache. So no associated symptoms. There are no associated, no dizziness, no cough, no flu-like symptoms. However, she has like a severe headache, and also joint pain and also muscle pain. No rashes. Uh, and then she said that the fever is continuous. However, she took the Panadol but not reduced. And then the severity of pain of the headache is at the pain score of 8. Um, she also complains. She also stated that she has loss of appetite with nausea and vomiting, and also she experienced diarrhea. And then her urine output, she said, is probably less than usual. And then from the history, medical history, she is a very healthy young woman. The only drug she has taken is only Panadol to relieve the effect of the fever, and she doesn't smoke and she doesn't take alcohol, and also she didn't travel anywhere for the past few days, and also her family is also healthy. Yeah, that's all. So
That's all. What is the diagnosis?
I expect that she have fever due to probably food poisoning, but it's not. I don't know very
Why food poisoning?
because she said that she has no flu-like symptom, and then she has
Mm,
said that she has not traveled anywhere for the past few days.
mm.
But the associated symptoms is loss of nausea and vomiting, also diarrhea. So yeah, I think it's because of food poisoning. However, I'm not very concerned about her less urine output because she said that she took uh, fewer than normal water intake because of loss of appetite. So
Any other differential diagnosis?
I can also give other differential diagnosis such as like probably due to infection of dengue, probably.
Uh, so what else you want to ask? If dengue,
If I would like to ask to dengue, I already asked her any um, rashes, but I didn't ask
uh,
about bite marks. I
Passport
don't know.
location.
ask what?
Fogging history at the recent area.
Yes.
Passport. The place.
Okay,
it
I
not-
want to ask other not patient. I want to ask others. Aisha, what the question I want to ask? So you have one.
If we suspected dengue
Uh,
as a differential diagnosis, we can
uh,
ask the area whether there is history of dengue patient at the neighborhood atau or we can ask about fogging. Have there any fogging activity at there in the recent few weeks?
okay, ada kan? Syaira.
Yeah.
So that's it. Okay. So what you suspect?
So dengue.
Dengue. So if
Excuse
dengue,
me.
what else you want to ask?
Um, What else?
So the patient have diarrhea, vomiting, nausea. What do you think?
Yes.
So is it
What
a
else?
picture of dengue? Is it a picture of dengue or food poisoning?
So if there's like fogging, so the most likely probably dengue.
Okay, what else you want to ask? If dengue.
For ask to the patient
Yeah. Further question.
for the question.
So the purpose of history taking is one is to find out the underlying diagnosis. Is it? Second
Yes.
is you want to assess the severity of the disease. And you to find out whether there is any complication of the disease.
Oh, I see.
After that, okay, if patient has been seen by other doctors, you want to know what has been done. What was the result? What medication was given? Okay. So now you already get the diagnosis. But of course, you need to rule out other differential diagnosis. Like you need to ask other question. The differential diagnosis. So now you want to find out how severe is the disease. How many days of illness? At what stage of the disease? Because dengue, there are 3 stages of dengue. Febrile stage, diffusion stage, and recovery phase. If there is any leaking, and then the recovery phase actually is reabsorptive phase. Reabsorptive phase. Anyway, you need to read about dengue. There is a guideline. Is there CPG on dengue? Malaysian CPG. 2015, I think the last one. You download the CPG on dengue. Clinical practice guideline. CPG is clinical practice guideline. So there's a lot of information there. Okay, so now you want to know, you want to assess how severe is the disease, whether the patient had complication or not, just based on history alone. So what
Yeah.
the question you want to ask?
Changes in color of urine.
Why?
Blood in urine.
So any bleeding is tendency or not? Is it?
Yes, tendency in the gum and soft
Okay.
tissue.
So therefore you need to ask, the bleeding problem or not? Okay. Gum.
Tissue.
What else? Nose.
Soft tissue.
Lagi. So maybe urine.
Yes, urine.
Lagi. What else?
And then changes in mental
Mental.
condition.
Why you want to ask? Why you want to ask about changing
Complication
mental
of condition dengue is
such as
yes.
mental? Okay, yeah, correct, right. Okay, mental changes. Okay, that suggests what?
The virus has been meningitis.
So meningitis or encephalitis or meningoencephalitis. What symptom? The patient has not severe headache. Is it due to the dengue itself or whether the patient encephalitis? What symptom you want to ask?
Vision, blurry vision.
Ocean. Okay, anything else?
Rigidity of the neck.
Okay, what else? So okay, drowsy, and then the
Drowsy.
worst one is fitted instead of fitting. And then okay, that could be encephalitis. What are the possible cause of headache, fitting, like that? It might be bleeding in the brain, intracranial brain. Okay. So other than that, what other question you want to ask? Look for severity. So one is the brain. Second,
Abdomen pain. Asking
why?
to rule out if patient maybe suffer from appendicitis, acute appendicitis.
Okay, this
Because
is
it's related to fever as well.
you want to find out a differential diagnosis like acute appendicitis. Okay.
Yep.
Possible or not acute appendicitis in this patient?
Possible because if patient suffer from abdomen pain,
So
and then we
which part of the pain? Which part of the abdomen?
right iliac fossa.
So must specify which side of the side of pain. This patient got abdominal pain or not? Any abdominal pain?
Miss Loyo, do you have abdominal pain?
No.
No abdominal pain. So you suspect appendix?
Cut out the appendix.
So no appendix. Unlikely lah, no abdominal pain. Only nausea, vomiting, and diarrhea. Okay. Okay, what Yeah, don't pain, yes. Okay, one of the pictures of severe dengue or dengue. You can classify to classical dengue, and then dengue with warning symptom, and dengue severe dengue. So now this is whether it's just classical dengue fever, or whether it's a dengue with warning symptom, or whether it's severe dengue. Severe dengue mean you have bleeding tendency, you have encephalitis, organ involvement, encephalitis, severe renal failure, severe liver failure. In dengue shock, okay? A lot of leakage in the pleura, cause pleural effusion, difficulty in breathing, confused, coma, and then fit. That one all severe dengue. So that kind of question you need to ask. Warning symptom. So the patient have warning symptom or not? The patient had urine output, okay? Reduce urine output. So maybe a leakage as cause of leakage in the third space, in the pleura and the abdomen, and then therefore intravascular volume reduce, and then reduce renal proportion, reduce urine output. That one possible. Second is maybe patient dehydrated lah. If patient take less food, less fluid, patient might be dehydrated. Therefore, it might be the cause of reduced urine output. Anyway, you need to consider it as warning symptom first until you clarify further whether this is due to dehydration or whether this is due to hypotension due to leakage. Okay, what are the warning symptom you need to ask in dengue? Urine. So nausea, vomiting, excessive lethargic, too lethargic, okay. And then bleeding. Where is
Gum
the common
bleeding.
site bleeding?
Gum bleeding.
What else?
I
Eye, not common. Skin,
Not common.
bruises, okay,
Petechiae.
yes. Hepatitis, okay. What else?
nose bleeding.
Female, sometimes patient did not complain. What question you want to ask for female patient? Female patient.
Bleeding.
Yeah, bleeding.
Vagina.
Okay. Other than that, is it common to have vaginal bleeding? What is the more common one for female patient? It's not menopause yet. Menstrual history. So it's very important. History must be complete. Your past medical history, medication history, surgical history, and other than social history. The other one is menstrual history. Okay. Any female patient, you must ask menstrual history. If already menopause, gynecological history. Any postmenopausal bleeding or not like that. So okay, so did not ask that one. That's very important. Sometimes you miss the patient actually have a bleeding tendency. Maybe you ask no, gum bleeding, no, bleeding prodromus, no, any blood in the urine, no. Okay, but the patient have a bleeding tendency. You might miss it. Okay, so in okay, if menstrual history, what kind of presentation? Is a bleeding disorder? Patient maybe not complain unless you ask.
Last period.
Yeah, of course you need to ask the last menstrual period. If patient not menstruating, so maybe you do not get the information. But if patient menstruating,
Is it normal or no?
how you want to ask patient?
Is it your period according to your
Okay.
month?
You ask patient. You ask patient.
Sorry, Miss Hu. Sorry, I need to ask you again. Okay, are your menstrual cycle is normal? No, mean it's according
you
to
ask.
your month.
Do you have are you still having menses? Okay, and then yes, and then when is your last menses period? And then basically mention, okay, that kind of question, you don't ask, do you, is it your menstrual is normal like that? That's not the good approach. The first thing you need to ask is, are you still menstruating? Are you not? Are you pregnant? Or are you still menstruating? And then that is the first approach. The second one, okay, when is your last period? Or you still having period now? That is kind of question, approach you want to ask. No, you ask, your menstruation is normal, not normal. That is not the good approach. Okay, can try again.
Sorry, Miss
Okay,
Yo. I need to ask you a few questions. Are you still menstruating? Are you still in menses?
Yeah.
When is your last period?
Currently at day 4 menstruation now.
Okay.
Begitu.
So normal, not normal?
Normal.
No, you have to ask further.
Oh, the flow.
If you
What about
suspect,
the color?
How about the color and the content of the blood?
No, there's not correct way. Okay, you
So-
want to know whether it's normal, not normal. You if a patient has bleeding tendency, how you want to ask patient?
What about the flow?
Okay.
Flow of your menses. Is it normal or is it less than usual or is it more than usual?
It just slightly heavier.
Slightly heavier than usual. I see. I see. Okay. Can you please tell me did you notice any abnormalities in the color and the consistency of your uh of the blood?
Itu tak ada. That one not okay. Usually if more than
Tak ada.
usual, but that color and so on usually not that important lah. Okay. You want
I
to know
see.
whether there is a excessive, not excessive than usual. So I further question. Your patient mentioned slightly more than usual. So you want to assess it, but is it correct or not? What further question you want to ask? You can ask patient, okay, what do you mean by more than usual?
What do you mean more than usual?
Usually on the first day of menses, I use 3 pads, but this time I use 5 pads.
Okay. So what do you mean? Okay. What do you think? Is it heavy or not heavy?
Heavy.
Not really lah.
Heavy.
But there is some. So
Heavy
there
than
is there is more than usual. Okay. There is picture suggestive of the patient might have bleeding problem. Okay. So heavier than usual. Usually 3 pad, but now it's 5 pad per day. So suggest there is a picture suggestive of bleeding tendency. Okay. So what else you want to ask? Other than that, symptom of warning symptom of dengue. Okay, difficulty in breathing, abdominal distension, abdominal pain. Okay. Any yellowish discoloration of eye? Do you notice any discoloration on your eye? Or thick color urine? Okay. If present, that suggests the patient has hepatitis. So massive hepatitis is a dengue warning is a severe dengue. If mild hepatitis, it's okay. Okay, but it's severe. If liver enzyme more than 1,000, considered as a severe dengue. Less than 1,000 liver enzyme, this is considered as just hepatitis. It's not a severe. Okay, just as two features. Okay, what are the warning symptoms? Postural giddiness. Okay, when patient stand up, when patient feel dizzy. You should ask any dizziness or not, especially when patient stand up. If patient stand up feel dizzy, that means the patient have a low intravascular volume. So either due to dehydration or due to vomiting, diarrhea, or there is a leakage of plasma into the third space in the pleura or in the peritoneum. So therefore, when you examine the patient, you need to look whether any pleural effusion, whether there is any ascites or not. If present, this indicated the patient in the leakage stage. Leakage stage usually occur at the day 3, day 4. Usually day 4, day 5. It's only 40 hours to 72 hours. After 72 hours, you will be very happy. Okay. All the critical phase already over. After that, it's only a recovery phase or absorptive phase. If patient have a leakage, okay, in the absorptive phase, okay, they will reabsorb back the fluid in the pleura, in the peritoneum. So therefore, very important to monitor the BP, the urine output, and the skin turgor, and the UAP, the next wind vessel. Okay, if wind is distended, okay, the patient you need to reduce the fluid. Otherwise, if you give fluid plus the reabsorption from this space, patient will develop fluid overload. The overload and then pulmonary edema. Okay, this is management of dengue. So okay, you want to know the severity of the disease. So for dengue, you want to know whether this patient at what stage, whether it's febrile stage, whether it's a critical phase or rickets stage, or deferment stage, or the other one is whether in recovery phase. And then you want to assess the severity, and then you want to know the severity, whether the patient in the warning stage or whether this patient is in the severe stage. So stages only 3: febrile, deferment, and recovery. But severity, you have just classical dengue with warning symptom. The other one is severe dengue. So you read again about dengue. So in this three, you need to know. Okay, based on three, you can diagnose already. Okay, the stage as well as the severity. This is the purpose of history taking. And then you need to be supported by clinical finding examination. Okay, what are the different diagnosis you want to rule out in this case? So one is food poisoning. Okay, food poisoning. What are further information you want to know? What type of food patient eaten?
Yes.
So what this patient have for the lunch, for dinner last yesterday and also last night. Because usually poisoning is 24 hours. Occur within 24 hours, not 3 days, 4 days, within 24 hours. So therefore, you want to recall back the type of food should be the 24 hours one. You have to recall that. And then same symptom among family members. If the same symptom, and then what you need to ask whether they eat the same food or not. Eat same food, and then they have the same problem, so you can diagnose food poisoning. That is an history you need to ask. So okay, so dengue, okay, okay. That basically that question you asked that one. So next is so okay, next what are the illness you need to throw out? Differential diagnosis. Food poisoning, dengue, and then fever 4 days, high grade, persistent, vomiting diarrhea.
UTI.
Urinary infection, but that one more common in children. Children, they have UTI, so may present diarrhea, vomiting. But in adult, not so common. Anyway, what symptom of UTI you want to know? You need to ask patient.
Abdominal pain when urinating, dysuria,
This is what else?
abdominal pain, flank, especially in the flank.
Pyelonephritis, what else?
Also
Frequency, dysuria,
pain.
groin pain, suprapubic pain.
Yeah.
Okay, and then
Also,
incontinence,
if
frequency.
it because of, like, for example, because of Neisseria species, you can ask about is there any rashes?
That one is different. That was genital urinary tract. That one's a pelvic inflammatory disease or sexually transmitted disease is different from urinary tract infection. That one is genital infection, genital tract infection. Urinary tract infection different. Urinary tract is only
urine.
kidney, ureter, bladder, prostate, and urethra. Urethra rarely present with infection. If infection the area, this is more of STD, sexually transmitted disease, and urethra. Prostatitis usually not that common in sexually transmitted disease. Okay. Okay, you already rolled out. What other infection you need to roll out? Presented with high grade fever for 4 days, persistent. So you need URTI, upper respiratory infection already rolled out. Okay, you asked about symptom of URTI, sore throat, runny nose, sneezing. Okay, pneumonia, cough, sputum, chest pain, difficulty breathing, wheezing. Okay, you need to ask. So therefore, if you did not ask that one, okay, if you did not review the system, okay, because it's not, just now you did not review the system. Semua sistem kena review. Kan ada soalan on sistem tu. Sistem. Review sistem.
Saya ada
Ada.
Saya ada, tapi patient kata no.
Complete review of the system. Otherwise you miss the miss maybe you may miss something, some information dah. So okay, lung infection, apa lagi nak rule out? Female yang middle age female fever. What infection? Lung, urine, genital, skin, dental, heart. Heart infected endocarditis. Infected endocarditis macam mana? It's a high risk patient lah. Whether the patient have IVDU or not, intravenous drug user, whether the patient have a congenital heart problem or not. And then if yes, and then you need to rule out infected endocarditis. Symptom of heart failure. Okay, basically that's the more of the common infection you need to rule out. Okay, any question? So okay, basically you still taking. You need to add few more questions.
Okay.
Okay.
Is it necessary for us to ask about the close contact to COVID-19?
Yeah, this is very important nowadays in the pandemic. Tadi you tak ada tanyakan travel history lagi apa? In terms of COVID tak ada, tak cukup kan? Only flu-like illness je tak cukup, okay? Flu-like illness you kena tanya ada anybody tak in the family member ke friend ke COVID ke, lepas tu symptom of COVID you kena tanya. Loss of taste, loss of smell. Other than flu-like illness, body ache, joint pain, sore throat illness. Other than that, you need to add other common symptom for. And then the most important is whether you already have vaccination or not. Okay, already completed or completed. So this always should be asked in any patient with symptom of fever, symptom of infection, as well as lung symptom, cough, difficulty breathing, or cardiac symptom, palpitation, reduced effort tolerance. So you must ask symptom of COVID. Okay. So any question? Any more question? If not, second case. Second case, what is the who is the next in the list? Atau volunteer nak kelak? Arfa tadi kan patient.
Ya, saya.
Okay. Siapa nak kelak ni? Volunteer. Tak ada volunteer. So next in the list. Siapa first in the list apa? Dah kelak belum first in the list? Who is first in the list? You punya you got the list kan? You punya group.
Ahmad.
Ahmad dah buat kan?
Ahmad.
Second.
Second siapa?
Ainan kot tu.
Takkan you all tak tahu. Siapa second ni? Tak.
Ainan kot, Ainan.
Ainan, ada.
Yeah, I'm here.
Okay. Okay, now you kelak second case. Okay.
You ready?
Ya.
Assalamualaikum. My name is Anna Nurstein. I'm one of the third year medical students. Do you have some time for me to ask you some questions?
Yes, of course.
Can I have your name?
My name is Johanna. And I'm 21 years old.
Is it 21 years old?
Yes.
Okay. And can I know why you were admitted to the hospital today?
I'm coming to the hospital because I have fever like since 5 weeks ago.
Did you take any medications for the fever before?
Yes. Actually, I went to GP like the first when I was having the fever. So the doctor gave me antibiotic like for 5 days, and also I have paracetamol as well. But the fever doesn't go down lah; it still go up.
Okay. And can you tell me more about your fever?
Actually, for my fever, it sometimes go down, sometimes goes up like that, and it still happen till today.
And were you admitted before due to your fever?
No, but I did go to the hospital about 2 days ago, I think, because I have like 2 episodes of high grade fever. Yes.
Okay. Can I know what was your diagnosis during that time?
The doctor said that I have like a viral fever. That's all.
Viral fever. Okay. You know what kind of viral fever?
Oh, I'm not sure about that, but the doctor said that I'm not sure about that, but it is just said that I was having the viral fever and I cannot eat well because I also have mouth ulcer because of it.
Mouth ulcers. Okay. Do you still have mouth ulcers now?
Yeah, I still have it. It is just that I have like it sometimes on and off. Sometimes there I have the ulcer, sometimes I don't, and it's been like this since last month.
I know if anything makes your fever right now that you're having any worse or any better?
Can you repeat? I cannot hear you.
Okay, does anything makes your fever better or worse?
I don't think so. Like I said earlier, I just take some paracetamol, but somehow the fever does go down, but it come back again.
Okay, so nothing triggering your fever at all?
Yeah.
So is your fever getting worse or it's just the same?
I do say it's get worse. Like initially it just go up to moderate, but nowadays it's more like high grade fever. The fever is more, yeah.
Did you manage to take your body temperature at home?
No, but when I went to the hospital, I mean like the clinic, my temperature is around 38 degrees Celsius like that.
So with your fever, do you have any other symptoms that you're worried about?
Yeah, I do. Like one of them is when my leg, I have rashes on both of them, like especially at the front part of my leg, and then it's not itchy. It's not itchy, and also, yeah, also my face is swollen a lot when I woke up in the morning.
It goes back down?
It, yeah, it's more at the morning after I woke up, and then I also have like hair loss since this 1 month ago. But now it's the hair loss is more right now.
Do you have any other symptoms?
I'm not sure if it is a symptom or what, but I have a protein urine since 1 year ago. But I don't go to hospital because I think it's normal.
I don't know if you have any chronic diseases at all.
Oh no, I'm healthy.
No diabetes, no hypertension, nothing.
No, I don't have it.
So the only medication that you took before was antibiotics.
No, I don't.
Can I know, do you have any headache or blurry vision?
I do have headache, but just mild one.
Mhm. What about your vision? Are you sensitive to the light or do you have blurry vision?
No, it's okay.
So do you have history of having fits?
Yes.
Do you have history of having fits or seizures or anything like that?
No.
Do you have dizziness?
No. The headache.
So does any parts of your body feel weak or numb?
Mm, no, I don't. I just a fever.
So do you have any chest pain?
No, I don't.
Do you feel like your heart rate is going up more than usual or it's normal?
Oh no, I don't.
Do you have any chills or night sweats?
Oh no, I don't.
Do you have shortness of breath?
Oh no, I don't.
And your sore throat?
No
Runny
sore
nose?
throat.
No runny nose either? Okay.
No.
So you said about your urine being frothy, right?
Yeah.
Do you notice that your urine is more than usual or less than usual?
I don't notice any difference about that.
Do you notice any blood in your urine or
No, I don't.
what about your frequency to the toilet? Do you feel like at night time you go more to the toilet? Or,
No, I don't.
and what about your toilet pattern? Do you find yourself having diarrhea or constipation?
Oh no.
And what about your menses? Do you still have your menses?
I do say it's normal. Yeah, I do have menses. Yeah.
It's also normal in quantity, not heavy or light.
Yeah.
Have any itchiness around the area or do you find any discharge?
Oh no.
Do you have any rashes on your body?
Yeah, I have rashes on my legs, both legs, and it's not itchy at all.
Can I know more about your diet? Do you skip any meals or do you take all your meals?
No. But yeah, I do have a big problem with my appetite because of the ulcers. So I just lost my appetite. But
Weight is normal or do you find yourself losing weight?
normal, I think.
What about your, do you drink a lot of water?
Yes,
Do you
what?
drink? Do you drink a lot of water? Do you drink enough water?
I think I drink enough water, I think.
Okay, can I know if you have any abdominal pain at all?
Oh, I don't have abdominal pain.
No nausea, no vomiting.
Oh, no, as well.
Um, can I know more about your family? Do you have any family history of any chronic diseases?
Oh, no, all my family is healthy.
So can I know what you work for?
I work I work as a cashier at the supermarket, but I don't work anymore right now, like for about 2 months because of the sickness I suffer right now.
So I hear that you work as a cashier. So you probably have a lot of contact with other people. Can I also check if you also have your vaccinations for COVID vaccination?
Uh, I'm not sure about that.
So you have all those 2 doses of COVID vaccination?
Yeah, I have.
Did you travel anywhere recently?
No, I don't.
Okay, what about your, are you married?
Uh, I don't. I think I'm single because I live with my parents and siblings.
Um, do you take any oral contraceptives?
No, I don't.
No, okay. Are you sexually active?
No, I don't think so.
Do you take any hormone pills?
No, I don't.
What about alcohol? Do you drink any alcohol?
No, I don't take alcohol.
What about smoking? Do you smoke?
Oh, no, as well.
Yeah, I think that's all. Thank you very much for your time.
You're welcome.
Okay, you want to present?
Okay, yeah. So my patient is Joanna, 21 years old. She admitted to the hospital due to fever 5 weeks ago, and her fever is progressive, and it goes up and down. Sometimes it goes down and sometimes it goes back up. And she has history of having high grade fever due to virus infection, I think, and also history of mouth ulcers. And now her associated symptoms are mouth ulcers, rashes on her front leg, but it's not itchy, and face swelling in the morning, and also worsening hair loss. And during the system review, I found that she has mild headache, no fits, no
Mild what? Mild what?
mild headache,
Headache. Okay.
and no weakness or numbness, no vision problems. And for her CVS, there's no palpitations, no chest pain. For her respiratory system, there's no chills or night sweats, no dyspnea, no runny nose or sore throat. Her urine, she complains to have frothy urine, but no bloody urine, no diarrhea or constipation. And she also have normal menses, no discharge, no itchiness or anything like that. And her abdominal pain, there's no pain for her abdomen, no nausea or vomiting either. And but she did say that she has loss of appetite, but there's no loss of weight, and she drinks enough water. Her family history is generally healthy, and for her social history, she works as a cashier but then stops for 2 months due to her fever. No traveling anywhere, and she's single, not sexually active, didn't take any oral contraceptives, and she doesn't smoke or drink alcohol.
What is the diagnosis?
I feel like it can be viral infection again.
Why viral infection?
She has rashes and mouth ulcers.
Okay, anything else? How long is the duration of the illness?
It's 5 weeks, so it could be pyrexia of unknown origin.
Can I add?
Okay.
I think it's leukemia
Why leukemia?
because I think she said it is very long and then long fever, and also she has like face swelling and like rashes. And then if I remember, I remember correctly, she also said that she has like hair loss, I think.
Okay. So what that suggest? So the patient presented with what? Fever.
Yes,
For how long?
5 weeks.
5 weeks.
5 weeks. Is it normal? Not normal?
Not normal.
What that
And she
suggest?
also,
Prolonged
she also
fever. Is it a viral fever?
No, I don't think
Like
so.
5 weeks still not settled, not resolved. So I like this. Okay. So anyway, initially presented with fever. So this time also come with fever. And then when you ask, okay, there are other information in this case, other pictures there. Okay. So although the doctors diagnosed as a viral, you had to analyze first. This fever is never settled in the last 5 weeks, unlikely to be viral. Although the others features suggest, okay, that or suggest viral, but unlikely to be viral, more than 5 years. So there is a lot of information here. So based on the information, you need to ask further questions. Some of the information there, some of the symptoms.
Can I
Uh,
add the differential diagnosis?
uh,
I think it's SLE
why SLE?
because of the rashes and also for the
Mm.
urine.
Mm.
I mean, because SLE
Mm.
can attack the kidney and cause kidney failure, right?
Yeah. So how long already this patient SLE? How long?
I don't know, but this might be the flare.
Flare. So patient already diagnosed, treated, and then after that flare up.
Oh, okay,
So
no.
flare mean, yeah, okay.
Okay, so haven't diagnosed yet.
Hmm. How long is the patient having a proteurine?
I don't know.
Tadi ada mention tadi kan?
1 tahun, 1 year, 1 year.
1 year. So you should go detail on that. So don't ignore all the information. This is very important information. You just jangan concentrate on fever ni, but other information you should take in consideration. You should analyze it. Don't just fever, and then you just consider fever. Okay, and then the others, you just think this is just associated only. Not necessary. Could be that other symptom is another important important point that the patient might have some other problem. Okay. So is it normal for patient who have a fever for 5 weeks and then develop hair loss? Is it normal?
No.
It's not normal. Hair loss is something is abnormal. Okay, must be manifestation of the disease, not because of fever. Fever, why? If you have fever, if that fever, the underlying disease not associated with hair loss, won't get hair loss. You develop hair loss, must be something. Okay, it's abnormal. So, okay, mouth ulcer, is it common to have a mouth ulcer?
No.
Associated with fever? No. Okay. Viral infection can cause mouth ulcer or not? Viral infection.
Yes.
Which viral?
Herpes.
Yeah, herpes. Okay. Is it normal for is it common for herpes to present with prolonged fever? Herpes infection. Is
Herpes.
it normal for herpes to present with fever? Herpes infection.
No, unless it is viremia.
It's not common for herpes. Okay. Herpes labialis. Herpes what? Oral. What are the herpes?
Herpes.
Okay. No, usually doesn't cause a high grade fever like that. And then too long some more. So it must be something else other than viral. So what is urine and then swelling of the face? If there is swelling of the face, what that suggests? You have to go further. Okay. Is it throughout the day or whether it's more worse in the morning?
Morning, right?
If in the morning you should suspect
Kidney.
what disease? Which organ?
Kidney.
Kidney. Why? And then in the morning you see, you notice the facial periorbital swelling is more much toward the afternoon and then become less. So if facial puffiness, periorbitally or swelling, you should also ask for the leg swelling. So always that ask that. This is a manifestation of renal disease, nephrotic syndrome, nephritic, renal failure. So more common for nephrotic syndrome and acute glomerulonephritis. So okay, so you need to ask why it was in the morning. So because when you sleeping, you lie down. When you lie down, so what happened? The most dependent area close to the heart is face compared to your leg. So therefore, the fluid retention will be occur or accumulation will be occur more in the face compared to the lower limb. Way to put. Toward the afternoon, because you are at the upright position. So the most dependent area is in the at the leg. So therefore the swelling more at the leg in the afternoon, but less in the face because no longer become a dependent area. So swelling less in the face. So this is typical for renal disease. Periorbital swelling worse in the morning, in the afternoon become less. Okay. So okay. What else? Apa lagi? Patient ada joint pain kan? You have to clarify further about joint pain lah. Fever with other manifestation, and then the other manifestation you need to clarify further. Like the headache. So headache, you know, okay, what question you want to ask. And then joint pain, you must also ask the duration, any associated with swelling or not, any redness or not, disturb the mobility of the joint or not. Is it persistent or on and off? Any morning stiffness or not? This is very important. Any joint pain and swelling, you must ask any stiffness or not. Because if stiffness more than 30 minutes, that suggests rheumatoid arthritis. It's less than 30 minutes, it's not rheumatoid arthritis. So other arthritis. If no stiffness at all, they want more of osteoarthritis, non-inflammatory arthritis. Inflammatory arthritis associated with joint stiffness, morning stiffness. And then the duration of stimulus is very important. If more than 30 minutes, usually rheumatoid arthritis. Less than 30 minutes, not rheumatoid arthritis, other arthritis. So you need to go for the joint pain, okay, whether it is just arthralgia or arthritis. The proteinous or urine also you need to ask, okay, is it throughout the day or is every time you pass urine, is there any blood stain or not, okay? And then over the last, how many months for urine? 1 year. 1 year, whether there is any changes or not in the term of proteinous, it is become worse. Is it the same type before? Since the 1 year ago. So okay. So of course, urinary symptom, the rest you have to ask. Okay, you just follow the system review there. You ask whatever in the system review. The other symptom. Okay, headache, joint pain, proteinuria, rashes. Rashes also you must ask. Is it only localized to the area, or whether also involve the other area, and then what happened to the old one, whether it still remain there, or whether it become dry, crusted, and then what medication you apply. So that one you have to ask. And then whether it's painful, painless, itchy, non-itchy. Okay, not only itchy, you must ask whether painful, not painful. If painful, what they suggest? Vasculitis. So exactly, they may have a vasculitis. If the rashes is painful, that one is vasculitis. So the picture of SLD. Okay, skin lesion. What the symptom just now? Head drop also.
Face swelling, hair loss.
It is already analyzed. So that's all. Okay. So basically, this patient have a prolonged fever associated with. I'm not sure whether arthritis or not arthritis because you did not ask further on that. Maybe the patient arthritis. But you need to ask further whether any swelling or not associated with joint pain. If yes, that means it's arthritis. And then the patient have hair loss, mouth ulcers, rash at the lower limb. What are the rashes you need to ask if you suspect SLD? Facial rash, any rash in the face or not? At the face. And then photosensitivity. So when you expose to sunlight, whether your skin become look like burn, look like burn skin. That is photosensitivity. Or the rashes become worse. That one is photosensitivity. That's one of the symptoms you need to ask. So there are not other criteria features for SLD. So anyway, today I just want to teach you how to get history, okay? Because the history actually quite straightforward. Patient will present with fever, diagnosis can be a straightforward, can be not straightforward. So you don't know the diagnosis, you need to do physical examination. That physical examination may help you for the diagnosis. Sometimes even with physical examination also they not give you a clue what is the diagnosis. Therefore you need to do other investigation. Okay. So these two cases actually quite a straightforward case. Straightforward case of fever. You can make a diagnosis clinically based on history alone. Based on history alone. Okay. Any question?
I have a question, doctor. What is the pathophysiology of hair loss in this
hair
case?
loss in SLE. Okay. This is actually a systemic inflammatory disease. Systemic or this is a autoimmune disease. It's actually it's inflammatory disease due to immunological problem. Autoimmune disease. Actually, the exact cause is unknown, but there are a few possibilities. One of them is actually vasculitis, because actually also there is a certain inflammation of the vessel. It's not only the small, medium vessel, but also small vessel. But usually it's small vessel. As a result of this vasculitis of the blood vessel in the hair and the skull, it causes a hair loss. vasculitis, small vessel inflammation.
So any of
Whether that is due to autoimmune problem, we affect to the hair follicle, that one still cannot prove it. Okay, cannot prove it. So actually the exact cause is not known. Only a postulation only.
So vasculitis can cause hair loss.
Yeah, the possible cause, possible pathophysiology, vasculitis.
Okay, thank you.
Okay, okay. Any other question? Of course, other disease also can cause hair loss. Okay, but in this case, because you have other features, and then when you diagnose actually based on this criteria, there are few criteria for the natural SLE. In the textbooks, you need 4 out of 12 clinical features for the diagnosis. But you should use the latest criteria for the diagnosis. One is SLICC, SILCC 2015. And the most latest is the diagnosis should be based on the EULA, European EULA, European League of Rheumatology Society, or ARA, American Rheumatology Association, ARA. Actually, both use the same criteria. So the double standard DNA antibody must be positive, and then plus you need another 10 point. And that 10 point can be from the clinical domain or immunological domain. Clinical domain, quite numbers there. Okay, they have a point. Okay, mouth ulcer is at certain point, hair drop certain point, renal proteinuria, okay, certain point. But you have biopsy, lupus nephritis stage 2 or 4, you have higher point. Okay, immunological domain, rheumatic factor or anti-nuclear antibody or complement C3, C4 low. This one all are actually immunological domain. And then each that carry a certain point. If you add all the point, okay, 10 or more than 10 plus positive double standard DNA antibody, so already confirmed for the diagnosis of SLE. Like in this patient, he already have few clinical domain. Hair drop is about 1 point. Mouth ulcer I think 2 point. And then fever 2 point. Arthritis, maybe arthritis 2 point. So already how many? 8 point. So you need this patient proteinuria. Proteinuria, if biopsy maybe more, depend on the histology. If not biopsy, is considered as 1 point or 2 point. So already 9. So immunological domain maybe complement C3, C4 maybe low. So you have another 2 point there, already 10 point. If double selected positive, already confirm the diagnosis. Confirm the diagnosis of SLE. So anyway, you can find this criteria from the internet, not from the textbook. Textbook, they did not use this criteria. So you find out from the internet. ARA or EULA, criteria for diagnosis of SLE. Or not to be confused, okay, better stick to one criteria. You can just read SILCC criteria, but in the clinical practice during exam, don't use this criteria. You just stick with the last criteria, the latest one. Otherwise, you will be confused. Okay, unless you already quite well with that criteria, it's okay. But you just still learning. Okay, you just know only about this criteria. Just stick to one criteria, latest criteria. EULA or ARA for the diagnosis SLE. Okay, any more questions? So anyway, we will learn more of SLE during clinical posting, internal medicine. There's a lot of SLE patient in the world. So it's very common in Malaysia.
No, if the patient is more likely to be rheumatoid arthritis or SLE, which one is more likely?
Why this patient rheumatoid arthritis? Is it?
If she has joint pain.
Joint pain, arthritis. Okay, there are criteria for diagnosis of rheumatoid arthritis. So, rheumatoid arthritis also have criteria. Okay, they must be involved small joint, how many joint, okay, and then from that joint you have how many point, and then must have morning stiffness more than 30 minutes, and then the duration of arthritis must be 3 months or more than 3 months. That is few criteria. Okay, that is criteria for diagnosis of rheumatoid arthritis. So you not simply diagnose as any patient with arthritis, rheumatoid arthritis. No, you have to be based on the criteria, whether fulfill the criteria or not. So like this patient, okay, I'm not sure how long is the arthritis. Okay, you need to ask. Okay, if let's say arthritis also already 3 months, already 3 months. Whether this is rheumatoid arthritis or SID or mixed connective tissue disease or overlap syndrome. There are case of overlap syndrome. That means you have rheumatoid arthritis, you have SID, maybe you have scleroderma at the same time. There are case of mixed connective tissue disease. You call it mixed. Okay. So in this case, you analyze further about the arthritis, whether fulfill the criteria for rheumatoid arthritis or not. If not fulfill criteria, the diagnosis still rheumatoid arthritis, SID. If the arthritis is fulfill criteria, that means it's already there for 3 months, and then also accepted morning stiffness more than 30 minutes each day in early morning. That suggests rheumatoid arthritis. And then there are also other features of SID, mouth ulcer, head drop, skin rash, prolonged fever, high grade. So you have point there. So in that case, you need to do a few tests. Okay, few tests. For SID, you need to do a double stranded DNA and other C3, C4 level complement and other immunological tests. But for rheumatoid arthritis, also you need to do rheumatoid factor or the other one. That one more antibody, which is specific for rheumatoid arthritis. I forgot the name. There's one more antibody other than rheumatoid factor. There's one more antibody specific for rheumatoid arthritis. If present, so that means this patient have a mixed connective tissue disease. Two connective tissue disease, rheumatoid arthritis and SID. So okay, any more question? I think that's all for today. So tomorrow you will have session with Prof. Asa and Dr. Said in the afternoon. For next week, I will give you the timetable by tomorrow or maybe during the weekend. Okay, that's all today.
Thank you,
Okay,
Doctor.
Thank you, Doctor.
Good,
Thank you.
Bye.
Bye.